Thank you for watching. My name is Angel. I'm one of the managers here at the Northwestern Transplant Program. We're going to be going over some key concepts for kidney pancreas transplant recipient candidates. All right, so with the transplant procedure, your transplant physician and surgeon will determine your need for a transplant. Technical aspects are discussed in the What You Need to Know About Kidney and Pancreas Transplantation video. If transplant is right for you, it has the potential to increase your life expectancy and or stop your current treatment, dialysis or insulin. How surgery will affect the recipient is explained in the What You Need to Know About Kidney and Pancreas Transplantation video. Recipient hospitalization and when daily activities may be resumed is determined on an individual basis. There are risks for evaluation and transplantation, including general and organ-specific risks, as well as surgical, medical, psychosocial, and financial risks. Please see the What You Need to Know About Kidney and Pancreas Transplantation video. So there is no comprehensive way to screen deceased donors for all transmittable diseases and organ donor risks, including but not limited to DCD, KDPI of greater than 85%, hepatitis A, B, C, malaria, and HIV. Deceased donors are evaluated and screened prior to transplantation, and malignancies and diseases may be identified and transmitted after transplantation. Results may impact post-transplant evaluation, screening, and management of the candidate. Furthermore, your team will let you know your specific organ donor risk at the time of an organ offer. Your transplant team. It is made up of transplant physicians, surgeons, social workers, transplant nurse coordinators, pharmacists, and registered dietitians. Indications for transplantation are discussed in the What You Need to Know About Kidney and Pancreas Transplantation video. Recipient responsibilities include but are not limited to medical and psychosocial evaluation and other testing performed at Northwestern Memorial Hospital. Return to NMH for scheduled follow-up according to policy. And the transplant program responsibilities include but are not limited to completing an evaluation and informing the potential recipient of all results, making a decision about the potential recipient based on the program's written selection criteria, and the ways that you can be removed from the waiting list. Ways to be removed from the waiting list include noncompliance, lack of follow-up, or incomplete testing. Northwestern will do a medical, surgical, financial, and psychosocial evaluation using Northwestern selection criteria. Sometimes recipients need to complete a reevaluation if too much time has passed or additional information is needed. All evaluations are brought to the multidisciplinary selection committee made up of the transplant team members. Listing process, GFR, waiting time, multiple listing, UNOS allocation, HLA, sensitization, ABO compatibility, and swaps are all discussed in detail in the What You Need to Know About Kidney and Pancreas Transplantation videos. Now, there are risks to taking medication that is needed, and the medication is needed for your entire life. Risk may include infections and malignancy. There are side effects of all medications that your team will review with you during evaluation. The cost associated with your medications will depend on your insurance and will be determined then. Your transplant physicians will inform you of any immunosuppression medication research protocols. After an organ transplant, it is possible a patient may reject the organ. Oftentimes it is treatable, but it could lead to graft loss in some cases. Please see the What You Need to Know About Kidney and Pancreas Transplantation video for more details. Financial considerations. Part of the evaluation includes ensuring insurance will cover your transplant and personal costs associated with transplant. And we do need to evaluate future insurability and ability to pay for medications lifelong. And the fact that if the transplant is not provided in a Medicare-approved center, it could affect the patient's ability to have his or her immunosuppressive medications paid for by Medicare Part B. Risks including but not limited to inability to obtain insurance coverage for future health problems related to transplants, eligibility for medical, disability, life insurance. The Scientific Registry of Transplant Recipients is used to show potential recipients a transplant center's one-year graft and patient survival. The website where you could find that SRTR is www.srtr.org. If you have any questions about the SRTR website, please ask your assigned transplant nurse coordinator. There are early and late causes of graft failure, and that is why it is important to be compliant with your medications and follow up with your transplant physician. The absence of a transplant surgeon or physician may impact a transplant candidate's ability to receive a transplant if an organ becomes available. Alternative treatment options are discussed in the What You Need to Know About Kidney and Pancreas Transplantation. Potential recipients can withdraw at any time during the process. Your transplant nurse coordinator will explain how the waiting list works, when you need to follow up, and what happens when an organ becomes available. Thank you for watching. Please bring any questions you may have to your clinic appointment. Thank you.